Hi, I'm Jacinda, and I'm going to be your student nurse today. Can you verify your name and date of birth?
Brittany Porter, 13191.
Okay. I'm going to do a complete head-to-toe assessment on you. I'm going to start by inspecting and palpating your head and scalp. I'm looking for any bumps, lesions, or abnormalities. Everything looks good. Now I'm going to palpate your maxillary and frontal sinuses. Let me know if you feel any pain. This is your maxillary. And this is your frontal. Okay. Now I'm going to inspect your eyes. I'm looking for symmetry. Everything looks normal. Now I'm going to inspect your conjunctiva. If you could look up for me. Conjunctiva is pink and moist. And I'm going to look at your sclera. If you could look down. Sclera is white and moist. I'm going to check your pupillary reaction. If you could just look straight ahead at me. Okay. Now if you could look at the wall behind me and follow my pen. Okay. Now look at me and follow my pen without moving your head. Good. Pupils equal round, reactive to light, and accommodate. Now I'm going to inspect and palpate your ears. I'm feeling for any abnormalities or bumps or lesions. I don't see any cerumen buildup or any drainage. I'm going to palpate your tragus. Let me know if you feel any pain. Okay. Now I'm going to inspect your nose. I'm looking for symmetry. It's symmetrical. If you could just look up for me, I'm going to look inside your nose at your mucous membrane. Mucous membrane is pink and moist. I don't see any polyps or lesions. I'm looking at your mouth. Your lips are pink and moist. If you could open your mouth for me. Mucous membrane is pink and moist. If you could stick your tongue out. Tongue is consistent in color. Okay. Teeth are white without dental caries, and I see no missing teeth. Hard and soft palate are normal. Now I'm going to inspect and palpate your thyroid and trachea. Your thyroid is not enlarged, and your trachea is midline. Now I'm going to palpate your carotid artery. Pulse is normal. Now I'm going to listen for any carotid bruits. I don't hear any bruits, and if I did, that would indicate stenosis, which is narrowing of the vessels. Now I'm inspecting your interior thorax. I'm checking for symmetrical expansion. If you would breathe in for me. Okay. Expansion is symmetrical and no accessory muscles are being used. Now I'm going to auscultate your lung fields with my stethoscope. Lung sounds are normal. I don't hear any bronchi, wheezing, or crackles. Now I'm going to inspect and palpate your anterior thorax cardiac. I am looking for any visible pulsations. Okay. Everything looks normal. Temperature is good. I'm going to auscultate your heart sounds. This is your aortic valve. It is right of the clavicular line in the second intercostal space. This is your pulmonary valve. It is left of the clavicular line in the second intercostal space. This is your Erb's point. It is in the third intercostal space left of the clavicular line. This is your tricuspid valve. It is in the fourth intercostal space left of the midclavicular line. This is your mitral valve. It is in the fifth intercostal space, left of the clavicular line. This is also your apical pulse. It is left of the clavicular line in the fifth intercostal space. And your heart is located between the second and fifth intercostal space. Do you do a monthly self-breast exam? It is important for both men and women to do one. It's easier to remember if you do it the first of the month each time. You would start by placing your hands on your hips. You would look in the mirror and look for any abnormalities or drainage or lesions or inconsistencies with color. You do, in the shower, you'd put one hand above your head, start in your auxiliary, and in a circular motion, make your way all the way around until you reach to the nipple. You're checking for any bumps or tenderness, and you're looking for any drainage in the nipple. You would do this on both sides. Then you would lay down on your bed, put a towel or a pillow underneath you, and do as you did in the shower on both sides. Now I'm going to inspect your posterior respiratory. I'm auscultating in the 10 posterior lung fills in the 11th lateral. Lung sounds are clear. I don't hear any bronchi, wheezing, or crackles. Now I'm going to inspect your upper extremities. I'm looking for any inconsistencies with color. There's no moisture, skin is pink and dry. I'm palpating for temperature. Temperature is normal. I'm checking your skin turgor. There's no tinting. Now I'm looking for any clubbing in your nails. No clubbing. I'm checking your capillary refill. Refills within 3 seconds. Okay, now I'm going to check your range of motion. This is flexion, extension, abduction, and adduction. Now if you can put your arms like this, I'm going to test your strength. If you could push out against my hands, good. Now pull in my hands. Okay. Now if you could push up on my hands. Okay. And now push down. Good. Okay. Now I'm going to check your abdomen. You could lay down for me. I am inspecting the abdomen for any abnormalities, any masses. Everything looks good. Now I'm going to auscultate in all 4 quadrants. This is your right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Vowel sounds are characterized as normal, hypoactive, or hyperactive. Now I'm going to palpate in all 4 quadrants. Let me know if you feel any tenderness. I am feeling the deep tissue organs, feeling for any enlargements. Everything is normal. Now I'm going to inspect your lower extremities. I'm checking for temperature. Temperature is normal. Now I'm going to, the skin color is consistent with the rest of the body. Now I'm going to palpate your popliteal pulse bilaterally. Your posterior tibial pulse bilaterally. And your dorsalis pedis pulse bilaterally. Okay, all pulses are normal. Now I'm going to test your range of motion. This is flexion, extension, abduction, and adduction. I would do that on both sides. Now I'm gonna test your strength. If you could push up against my hands. Good. Now if you could push down against my hands. Good. Okay, I believe that's it for our head to toe assessment. Do you have any questions?